Hello everyone, my name is Martin Sanchez, and this work here presents our project on using extended reality to monitor, predict, and support interpretations of hospital readmission risk. Rather than focusing only on improving prediction accuracy, our goal is to explore how clinicians can better understand risk probability, especially in situations where time is limited and uncertainty is high. Now, hospital readmissions remain a major challenge in healthcare, particularly for patients with chronic conditions such as diabetes. And while machine learning models can estimate readmission risk, these predictions are naturally probabilistic and oftentimes can be difficult to interpret in practice. And clinicians operate under significant pressure and cognitive load, making it challenging to contextualize probabilistic model output within a patient's full clinical picture. Thus, our goal here is to combine machine learning for prediction with electronic health records and mixed reality into a single pipeline for intuitive, real time spatial visualization at the point of care. We used a large clinical dataset consisting of over 100 hospitals with about 100,000 encounters and 50 clinical variables. And one challenge that we came across is that the dataset is highly imbalanced, with only about 5% of patients being readmitted within 30 days. And despite this, we did observe some meaningful trends. For example, patients with multiple prior hospitalizations show significantly higher readmission rates, and those with longer hospital stays are also associated with increased risk, including those discharged to skilled nursing facilities, rehab, or those who left against medical advice. These predictive patterns align with known clinical factors and provide a foundation for risk estimation. We then trained an XGBoost model to estimate readmission risk. The model achieves an AUROC of about 0.72, which is very consistent with existing literature, as well as a lower precision recall score due to the class imbalance. Important predictors include prior inpatient visits, discharge disposition, and indicators of glycemic control. And although performance could be improved, it's important to emphasize that our goal is not to maximize predictive performance. Rather, our goal is to generate stable probabilistic estimates that can be meaningfully interpreted by clinicians. And to support interpretation, we developed an extended reality interface called the patient card. The system translates model outputs into a spatial floating panel anchored at the clinician's field of view, presenting color coded risk level, contributing factors, and general patient context. Additionally, it features on device inference and hands free interaction, all of which is developed on the Apple Vision Pro using Swift UI and Reality Kit. The patient card is simple to use and easy to set up. And the first thing you'll see is a patient dashboard showcasing an estimated probability of readmission risk. Users will be able to customize their current view with a combination of predictive factors, discharge plan, comprehensive patient info, as well as tracking for patient intake and output, giving us an interface that highlights why a patient may be at risk using visual cues and spatial organization. The goal here is to support awareness and prioritization, not to automate clinical decisions. And here we have a quick pre-recorded demo to showcase the patient card. The system allows for hands-free interaction, utilizing pinch gestures, which is important for maintaining hygiene in clinical environments. Besides floating anchored panels, users are also able to fix them to their current FOV, allowing for customization and personalization for users. And moving on. At the same time, this work has some limitations. Our dataset is retrospective and reflects data from 2008 and earlier. The model is also affected by class imbalance, which reduces precision and introduces potential bias. The system has yet to be evaluated in real clinical environments as well, and for these reasons, we consider this a proof of concept system rather than a finished clinical tool. But the system has some promise. It's designed to enhance bedside decision making, pushes the move from 2D dashboards to a spatial patient card, and reduces cognitive load and split attention effect. Moving forward, future work will focus on evaluating how this approach fits into real world clinical workflows, validating the model with more clinical datasets, and conducting user studies comparing XR with traditional dashboards. To conclude, our contribution is not just a predictive model, but a design perspective. When predictions are uncertain, as they often are in healthcare, how we visualize them becomes important, and extended reality offers a promising medium for supporting responsible interpretation of clinical risk. Thank you.